afternoon, everyone. It is 2:30. Welcome to Cook County Health Department Schools in COVID-19 Weekly Update. My name is Kelly Jones. I am a senior health educator with Cook County Health Department, and I am your moderator and your host for these webinars. I'm going to mute Nicole. You became unmuted. We have a change in our format today. We're trying to accommodate our speaker's schedule, so we're going to change our format. And first up, we will have Dr. Corpix, who will talk to you all about the much anticipated approval of vaccine for ages 5 to 11. Then we will do our communicable disease update, and we'll have announcements last. That way we can accommodate all of our participants. All of our participants and their schedule. So I will stop sharing and I will let Dr. Corpix have the floor. Welcome, Dr. Corpix. Glad you couldn't make it.
Thank you, Kelly. So I will just go over some updates about vaccination and then answer any questions. I'll try to go quickly. And then I do have an ask that those on the call fill out a survey. So I'll put that in the chat. It will just help in our vaccination planning.
Sure. Before you begin, I just wanted to ask, we usually turn our chat off. Would you like to chat on right now during your presentation?
I'm fine either way.
Okay. Yeah. That way participants can ask questions. Go ahead.
So just an update. The most recent updates I'm sure you heard are the boosters. So now they're approved for Pfizer, Moderna, J&J. If you got Pfizer, Moderna, you should be in one of the following categories: 65 plus or 18 plus either long-term care facility, living in a long-term care facility, having an underlying medical condition, or living or working in a high-risk setting. But then if you got J&J for your initial series, then everyone who's 18 plus should be getting a booster. So a little bit different depending on if you got Pfizer, Moderna the first time or J&J the first time. And then the Pfizer dose is the same. The J&J dose is the same. The Moderna booster is just half the dose. But most providers are, as long as they have Pfizer on hand or Moderna or Johnson & Johnson, they're doing those boosters on site because they already have the vaccine that they need. For Moderna, they just have to draw up half the volume. And then mixing and matching is approved. That makes it easier logistically. So if like a provider isn't carrying one or the other, someone can still go get their booster there. All are considered to have strong responses. And we encourage people to talk to their doctor if they're eligible for a booster and they're not sure which one they want to get, if they want to get the same one or a different one. But that is all new. And then youth vaccination, like Kelly talked about. So that's coming very soon. So the FDA committee already met, they voted. Now they just have to like officially issue that emergency use authorization, the EUA. And then we have to wait for the CDC or ACIP committee to meet and vote, and then have the official approval from CDC. So all of that is expected to happen next week. After it is a new vial because it's a different dose for the pediatric 5 to 11 versus the 12 plus. But we're expecting those vaccines to start shipping out next week. But we just can't, no provider can actually use them until CDC gives their approval. So the soonest possible day providers can have it on hand would be November 4th. But some providers are still going to take some time to do like training if they're not used to seeing pediatric patients, or they may not get the vials immediately on November 4th. So it'll be a little bit different. Like with the boosters, it was pretty easy to say, okay, boosters are approved, like go on and, anywhere and get your booster. Because this is a different vial, it may be a little bit different this time around. We do anticipate a lot of parents are going to want to go to their medical homes, their pediatrician, their family doctor, whoever. So we're trying to get more providers on board. There's not enough pediatricians currently providing vaccine, but the Illinois chapter of the American Academy of Pediatrics is working closely with us and with the state to make sure all pediatricians are, we're removing any barriers and making sure they offer it. But in addition to that, we know not every family has a medical home. Uh, and some are going to want to go to a school clinic, or they're going to want to go to a community clinic, or maybe their local pharmacy. So local pharmacies will also be offering the pediatric vaccination. And then we at our mobile clinics will be offering the pediatric vaccination. And there's definitely been a push nationally to offer as many clinics as possible on site at schools. We know that there's a lot going on at schools, and school staff are incredibly busy, especially with all of the contact tracing. But we definitely encourage schools to host events. We want to just basically make vaccine available at any and every opportunity, so that parents are really encouraged to get their child vaccinated. We know that vaccination is really our way out of this, essentially. And so schools definitely once shots are mandated, schools are really the reason that kids get vaccinated, because they need to go to school and they need to prove to the school that they've been vaccinated. We know at this point there's no mandate, but there still is a push nationally to work with schools and try to hold clinics there. And as we also work with pediatricians, pharmacies, hospitals, other providers. And so it's exciting because, you know, now we're talking about having the good majority of kids at school vaccinated, which makes us all feel better about, where we are in terms of the pandemic. In terms of our jurisdiction, having 5+ approval means that over 93% of our population is actually eligible for vaccine. So, getting close to 100% of vaccination, or 90% vaccinated, is actually feasible now based on eligibility. So that's super exciting. We definitely know that schools have constant contact with parents. So we're wanting you guys to be encouraging this as much as possible, and we'll be doing the same. And then we'll await the data for children 6 months and older. We're hoping for that data by the end of the year, so that approval processes can start at the beginning of next year, but we still wait for more data on that. So we're still at less than 70% of our total population vaccinated. We really want to get, beyond that. Youth is a big focus. We're actually not doing as well as Chicago is in terms of youth vaccination. So even for the ones who are eligible, so 12 to 17, we're behind Chicago, who's at about 70%, over 70% vaccinated. We're in about the 60s. So we have a lot of work to do for 12 to 17 still, in addition to 5 to 11 soon. And then a lot of work to do on our south side, especially because that's where we're seeing a lot of low vaccination rates. And so a lot of our hyperlocal program really focuses on events and education, and we really rely on partners and people who have, consistent, trusted contact with families. And we know that schools are that. You're a trusted entity in communities. And so the hyperlocal program, in terms of holding events, doing education, doing outreach, really does rely on entities like schools. So our website has not changed. Our hotline has not changed. This is the best way to request a mobile vaccination clinic. You can either go, to either of these links and then just submit a request. And then we will send you a partner. Sometimes we send ourselves. Sometimes we send the Cook County Hospital. Sometimes we send one of our partners like Simpar or Prism or Jewel Osco. And then schools have been encouraged to specifically reach out to Jewel if they want to work directly with Jewel. You don't even have to go through us. A lot of people want to be holding clinics at schools. In addition, the state, so the IEMA and IDPH have been calling every single school in all of Cook County offering a clinic. So we work directly with them, and they kind of give us feedback on which schools have taken them up on the offer and which haven't. And we've asked them to go back and recall all the schools now that we know that this 5 to 11 approval will be happening. And then I'm going to put this survey in the chat. This is just kind of helping us understand, what are the barriers to holding clinics at schools and or providing outreach and education at schools. Believe us, we definitely understand how much you guys are already doing. We talk about it, every Friday on these calls, all the constant changes and guidance and everything that, is involved with contact tracing. But we, as the health department, want to, figure out, especially without a vaccination mandate, how can we get as many kids as humanly possible vaccinated, because we know that that'll make all of our schools safer. And then this is just more information about what it means to request a clinic. Then we post if the school can have an open or closed event. So you can say, I only want students vaccinated, or I only want students and parents vaccinated. Or you can say, anyone can come to our school and in our community and get vaccinated. That's totally up to the school. And I would say the good majority of schools just hold closed clinics for students and parents only. Most clinics do require the parent present to do the consent, but some providers only require like a signed form. And last I checked with Jewel Osco, that's all that they require. And then we're working with our legal team to see if we can kind of go with a similar approach just to make it easier on working parents. And that we still have our in-home vaccination program. Currently target seniors or people with medical issues that make it harder for them to leave home. We have a free transportation program. You can go get transportation to and from your site for free on the county. So if the vaccine site is at your school, then parents and children can use this program. And then we try to post updated information on our website that we really do hope that schools do utilize and share with parents and families. And same with our My Shot campaign. And then still giving out the Binax Now test. We were told from the state that we should be using expired tests as long as we're still using still testing, doing the internal testing and everything checks out, then you're good to use the expired Binax Now test. The reason behind that is because there is a national shortage of Binax Now tests. But as long as you use the control, everything looks good, you can still use expired tests to this point. And then we do have PPE that you can request. And I've seen that some of you have been doing that, which is great. And that's all I have. So let me just look at the chat if there's any specific questions, and then I can share. Actually, let me just share the survey because I'm really hoping to get any feedback that can help us figure out how we can be helpful. Oh, great. Okay, so on this call, it happened, the EUA happened, so that's great. FDA issued the EUA, so now we're just awaiting the CDC to meet next week and officially approve it, so that's great. And then I see some comments that some people are already planning with Jewel Osco, so that's awesome. It looks like they did change their requirement for 5 to 11 and do want the parents present. So that is pretty standard. We still have a few providers who don't require that. So if that's something you really want to push for, we can work with you on that. But it does seem like that's the majority of providers are requiring the parent or guardian to be present. Okay, I think that's all. I don't see any other questions. You can add some in the chat if you'd like. I can be on until 3, so I'm happy to answer any other questions.
Thanks, Dr. Corpus. We appreciate you taking the time out. I know you have to leave at 3. I think Lex has to leave at 3 also. So if there are no questions for Dr. Corpus specifically, we'll go on to the communicable disease update, and then you can ask questions to Lex about the upcoming metrics. Thanks. Go ahead, Lex.
Thanks, Kelly, and thanks, Dr. Corpix. Everyone just give me 1 second to share my screen. Okay, get this out of the way. All right, so because we knew we were going to have Dr. Corpix on and there's not too much new information, basically this is just going to be a metrics update, some Halloween tips, and I did put together some literature if you were interested on the COVID vaccines in kids. So usual reminders, we've got an epi on call for outbreaks after hours and on the weekends, but otherwise please give us a little bit of time to get back to you. The first place you should always check is our website. It's got pretty much everything hopefully organized in a really usable way. You can find old recordings of our webinars that will link to the YouTube link. And also a reminder that our outbreak definition changed. I think you guys are all familiar and aware of this at this point in time. Again, for outbreaks, gather as much information about dates of tests, of exposure as possible, and if these are people who could have potentially had contact outside of the school setting, like a play date or a party or whatever. All right, so we are in fact heading in the right direction. Slowly, very slowly, but we're getting there. So here's just for Suburban Cook. You can see that we're kind of on the downslope. I do want to remind everybody, but for the last like 2 bars here, there's always going to be a little bit of a lag as we're catching up with reported cases. So it's always going to look like we're just about dipping for the last little bit of data just because we're behind on getting that in. So whenever you see that dip, don't automatically assume that means we're heading in a downward direction. I just wanted to remind you guys. You can see from September that we are truly heading in the right direction with cases decreasing for now. Knock on wood as it gets colder and colder and we're staying more indoors. But I just wanted to remind everybody that this is a data lag, not necessarily a true decrease. And then this is from IDPH that breaks it down into different age groups, just reflects the same pattern as ours. We are still in substantial transmission. We're pretty much in the exact same place we were in last week with we increased by 0.4% the total population with completed vaccine series in the community who are, but hopefully that will go up now that the EUA has gone through for kids. There are 138 active outbreaks in Illinois, and 34 of those are in Cook County. So state outbreaks decreased, we decreased slightly. So that's where we're at with metrics, heading in the right direction, slowly but surely. For travel guidance, you can now go to, I guess, the Gulf Coast except for Alabama and Texas safely, which is a little bit surprising, but I guess they're trending pretty well. So those 4 states down here were added. And a reminder, don't travel if you're unvaccinated. Hopefully people who do intend to travel for like Thanksgiving or any of the like Christmas, Hanukkah, wintry holidays, or New Year's, hopefully their kids will be able to get vaccinated by that point so the family can safely gather. The vaccinated traveler guidance is pretty much the same. So I am a vaccinated traveler. I have to cut out early because I have to go.
I think you really cut out, Lex. You weren't kidding. You trying to get out of here. So while Lex is frozen, we'll just give her a second to log back on, and then we will continue. Halleck, did you want to take the slides while we're waiting on Lex?
Sure. As Lex mentioned, this is a travel guidance. I'm not going to go so much into detail as all of this is on the website. If you do have any questions, please go ahead and put them on the chat. Concerning the question from Kimberly about testing 5 to 7 days, thank you for pointing that out. We will change it on our slides. On the FAQs, it is 5 to 7 days for unvaccinated students, for anyone who wants to get tested as well after travel or after exposure. I don't have, let me open up the slides from Lex so I can.
Let me see if maybe I can stop her share so then you can start a share. Hold on one second.
1 second, let me try opening her slides. 1 second.
Hey, can you guys hear me now?
We hear you.
Oh, I'm so sorry about
Okay,
that,
great.
you guys.
That's okay. You were just trying to leave a little early on us. You said, I got to get out of here. And then it froze. And then that was it. You really are trying to go. So continue.
All right. Is this about where I cut out?
I think the slide right before that, but that's fine.
Okay. So basically, I was just saying that we are trending in the right direction. We're in substantial community transmission. We're going in the right direction slowly but surely. And hopefully we'll get that percent of the total population with complete vaccine series up as kids can get vaccinated. All right. Some of the Gulf Coast states were added to the okay to travel to area. So if you're getting tired of this weather already, you could safely travel to a couple of those states. But as always, if someone is unvaccinated, they shouldn't be traveling. Now that kids can be vaccinated, hopefully they can get their vaccine in time for the Thanksgiving, winter holidays. So that's a great option for them, for the families to safely gather. Travel guidance hasn't changed. And then just a couple of tips for Halloween. Going trick-or-treating, celebrating Halloween is perfectly safe. Outdoor transmission is super, super rare and mostly happens in crowds. So going with a couple of friends is a-okay. Having an outdoor party, like with a bonfire or pumpkin carving, also totally safe. You don't have to wipe down candy or like leave it somewhere and wait a couple days to eat it. That's not necessary. And obviously, I mean, if your kids have planned costumes already, you can incorporate fun masks. And then if you are actually going to hand out candy to kids, you should be wearing a mask. It will just make the kids and their families feel safer. Even though that contact is very brief, you should be wearing a mask if you're going to literally hand out the candy. And of course, be washing your hands frequently. If you feel ill, do not hand out candy. The safest way to distribute candy is, have a supervised bowl a few feet away from you if you want to chill out on your porch or whatever. I think the weather is supposed to be pretty nice. So that's the recommended way. But I know last year my family literally made a 2-story PVC pipe tube to throw candy down, and that was pretty popular. So lots of safe ways to handle it. I hope everybody has a really good weekend. We just had one submitted question, and I left the one about band and orchestra on from last week in case people are still trying to plan concerts and missed this. So the question we got is, if a student tests positive for COVID and is exempt from quarantining for 90 days, basically, when does that 90-day count start? And the answer is from the date of receipt of their last positive test. So not when their symptoms began, it's from that last positive test. And they should resume testing if you've got a screening program after those 90 days are up, because people can be continuously testing positive for a while, even though they're not infectious. So, they may be forced to be excluded, even though they're not going to infect anybody if they resume testing before those 90 days are up. And that's more about individual biology more than anything else. So that was the submitted question. And then a couple of you asked for some literature on kids and COVID vaccines. So at the end of the reference slides, let's see. It's kind of small font. I'm not going to read it all to you, but I just wanted to let you know that I've got information on how effective it is in certain age groups. They're all for younger kids. If it's effective against Delta, how that impacts the households if the kids get vaccinated, or if the parents get vaccinated and the kids don't, how does that look in a household? You've probably heard that there are a couple of cases of myocarditis associated in younger age vaccination. That is exceedingly rare, like counted on one hand rare. But I do have a study that talks about that, so you can reference that if you have parents that are worried about that. You've also got, let's see, oh yeah, so the one about myocarditis is number 6. And then I've got a whole nother page. So there's lots of good resources here for you. If there's anything specific that you are hoping for a study on, certainly pop that in the chat. But yeah, those are some resources, and I will stop sharing and send out that PowerPoint to Kelly to give to you guys. I'm gonna hop off in a second, so I hope everybody has a really good holiday weekend.
Thanks, Lex. Enjoy your trip. Safe travels. And then I'll just toss it over to Palak to answer any questions that are in the chat if she hasn't already done so.
Hi, thanks, Lex. Hope you have a good weekend. I have answered almost every question that was related to schools, and Jackie's been answering questions concerning the vaccine. So think we have some time. We can wait for some questions. Otherwise, we can end the webinar.
Okay, while we're waiting on one more questions, I will just go ahead and start sharing and just share the upcoming announcements. And we can keep looking for questions while we're doing that. Hold on, I have to move this out of my way so I can see. All righty. So we know our meeting objectives. We'll just zoom past that. Webinar recordings are recorded and uploaded to our website as well as our Cook County Health Department YouTube page. We normally turn our chat off. Today is a different circumstance. Here is our contact information. If you are looking for reporting diseases, general questions, our website, and then our website for vaccines as well as for any communication tools that you can download. Please send all EpiPen requests to me, Kelly Jones, at kjones1 at cookcountyhhs.org. Please make sure that the request comes from your school nurse or medical professional who is certified and trained on the administration of the medication, and all requests must be typed. So Dr. Corpix included a lot of this in her presentation, so it's a little bit of a repeat, but information on our PPE distribution and some upcoming events. Dr. Corpix will be speaking on Cook County Health Department's Facebook Live this coming Wednesday, November 3rd, speaking about the COVID-19 vaccine and any questions you may have. So if you didn't get your question answered, you think of something after the fact, you can log on to that and ask Dr. Corpix some questions. There is a family event called the Great Tiny Pumpkin Hunt tomorrow at Sandridge Nature Center. I will be providing some health education, and we will be also providing COVID-19 vaccinations in addition to the family-friendly Tiny Pumpkin Scavenger Hunt along the trails of the Forest Preserve. So please bring your little ones out if you like. There's a vaccine event that is November 6th, Summit Park District, and here is the flyer there's a flyer in English and in Spanish. And also Cook County Health Department will be back at Chicago Ridge Mall for those people who participated in it 2 weeks ago. You can come out and get your second dose next week, November 4th through the 6th, 11 to 4. The hours have changed because of the time change. It's getting darker faster. So we have to close up shop a little bit faster. So here's that flyer in Spanish for the summit event. And then also there's a free vaccination event at Marionette Park Village Hall next week from 10 to 3 as well. So as Dr. Corpix showed, there's our calendar of events. You can go on and see all of the upcoming events that we are sponsoring, co-sponsoring, and partnering, and information on school clinic sign up that Dr. Corpix already covered. And here's information if you're interested in hosting a vaccination event. This is just some tips and some tools that'll help you have a successful event. Educational resources that you are free to print and download, and also information on our My Shot campaign. So we just went around to all of our community events that we've hosted, videotape community's reaction, and it's a great YouTube video. So please check it out when you get a chance. And more information. And this is the link that Dr. Corpix has been sharing about their COVID-19 testing program, and as well as the link on information about your vaccination program if you're interested. Information on Binax, and someone in the chat asked about the Shields testing. This is where you can reach out to email about information about Shield. All of these links and the slides will be in the webinar that you the slides that you receive after the webinar. And if you're interested in having someone speak to your event about COVID related subjects, here's the link for that as well. Rides to COVID-19 vaccinations. They will pick you up, drop you off, and then bring you back home. and information on our homebound vaccination program. So I think we have covered everything else. I'm going to stop sharing and then we can check and see if there are any more questions in the chat. If there are no updated questions in the chat, then we are finished at record time and I'll let you guys go out and get trick-or-treating. So are there any questions that we didn't cover, Palak?
Doesn't look like there are any questions. I did ask that if there are any specific questions, email us at ccdph_schools. But for any clarification, for guidance, any general questions, you can always put them on the chat.
Sure, sounds good. We'll give you guys another minute or so if you want to put anything in the chat. Otherwise, we will see you next Friday. Enjoy your holiday if you celebrate, and don't eat too much candy. Don't scare yourself too much, and try to enjoy the nice weather tomorrow because it's been pretty yucky the last few days. So if there are no other questions, thank you all. Thank you, Palak. Thanks, Dr. Corpix, and thanks, Lex. Lex, enjoy your weekend. We will see you all next Friday. Thanks a lot. Bye-bye.